and welcome back to the Dawn Show. We are live and we are local, and we're talking about your health, how to beat the stress and beat breast cancer, even prevent it. Let's talk to breast cancer survivor and thriver, Diane Henn. And Diane is also the president of the Healing Consciousness Foundation. It's so good to have you here.
Thank you. It's great to be here. Just celebrated 7 years of cancer-free.
Woohoo! Victory lap.
Awesome.
7 years. And thanks to Dr. Beth.
That's
or Beth.
right.
I'm not supposed to say Dr.
You can
Beth,
say
so.
doctor. You call me whatever you want.
No, you know, what I hear Beth saying is type A personalities, stress is a killer. Is that you? High-powered?
Absolutely. That's absolutely me. When I got my diagnosis, actually, Beth wasn't my doctor. She was my second opinion. But my husband and I went to see her as a second opinion, and we hadn't even left the office, and the two of us were like, if my life has to be in anybody's hands, it's Beth's.
Wow.
So we switched to Beth. But yes, in terms of my personality and the personality of many young women who are diagnosed, I was 30, just turned 38 when I was diagnosed, is this type A. I was commuting to New York and to 3 cities probably a week and international travel, and didn't really have a good family, work, life balance.
And this is a lot of women. Back in the day, it was the Angeli woman, and I don't even know what it is now. It's every woman. It's every woman is spinning plates and trying to be all things.
We delay childbirth for our careers. We don't breastfeed because we don't want to take the time away from work. And we put a lot of stress on ourselves. And so although we may have won the women's lib issue, we've kind of shot ourselves in the foot because we miss out on a lot of things in life that really matter. And unfortunately, it shouldn't take a breast cancer diagnosis to give you that lesson, but I think Diane got the lesson.
That's right. That's really the blessing in cancer for me. I was in Beth's office. We fought the fight. We fought the good fight. We came out on the right side. We beat cancer. And I was in Beth's office and really saying that I didn't feel right. And I didn't know, type A's, we are the rock, right? We're the people. I was an executive at a company. People came to me to solve problems. I was supposed to have all the answers. Of my group of friends, I'm the one that people came to for advice. I don't ask for help. So Beth helped me see, I didn't know what kind of help to ask for, really. I didn't know I needed help. And Beth said, Diane, you need to find your reset button. You need to go see Mary Lou.
Mary Lou is one of our amazing holistic practitioners who, it's like having an hour with your guardian angel to give you some guidance in your life. And you should go sometime. You should go before you get cancer, I'm telling you. It would save a lot.
Before I get it.
No, before anybody gets any kind of illness. Because what she does is she helps you realize what matters in life.
That's exactly what happened. So I bridged going from cancer survivor to thriver at the point where I started to see Mary Lou. She helped me make changes in life that were healthy. Changes like
quit a job.
Exactly. She gave me the courage. Like, I was struggling with being a mom. My daughter was 21 months old when I was diagnosed. I felt like I was missing out on things with her. I wanted to be the class mom in the preschool. I wanted to see all the things. When I was, when you're in Tokyo, you can't just pop over to the school. So Beth helped me really see
prioritize.
Yes. So when I went to Mary Lou, all of a sudden things became more clear for me. And I had the courage to make the choices to do the things I really wanted to do. And that was to leave a job. That was a great job surrounded by great people who stuck by me through the cancer. There was nothing wrong with the job I have. It paid me very well. I was very successful. So it was tough to leave that, and that was part of what defined me too. We spend 10 hours a day or so at work. So it gave me the courage to leave that, and I was class mom for my daughter. My daughter's 9 now. I mean, you have a son who's 9.
That's my son's age, Michael. No, I relate to what you're saying. I want to get to, though, that you're having a fun, speaking of getting out and having fun, you have a fun event.
You like shoes, right?
Yes, we love.
Do you like?
Can we show our shoes?
Do you
Look
like
we wore our pink.
Do you like pocketbooks?
I love it, yeah,
We have
pocketbooks.
Pink Out Prize Bingo.
October 26th.
And it's going to be an amazing event we've got fabulous bags. Some of my patients who work for QVC have donated awesome bags.
Fun.
It's going to be a lot of fun, and we're giving away a cruise and airfare to a lucky thriver. So it's going to be a pretty amazing event. It's going to be a lot of fun. I think I'm calling the numbers. I think that's my job. And my son and his friends are going to get Lynx hours from high school to come and volunteer for us. So the event you can find information at hcfbucks.org. It's one of the little sliders. My sister redid our website. She's fabulous. So you can get all the information that you need
Ann,
from there.
Your sister.
You got to meet Ann. She's
and
a
I
rock
like the way
star.
you say your older sister.
Oh, just slightly.
Put that in there. Shazam.
My mature sister. She was like my second mom. What can I say?
Mature sister is even worse. Diane, thank you so much. We're going to continue on the Dawn Show. We'll be right back. Thanks, Diane. Back with Dr. Beth DuPree, and Karen Jane is with us, and she's a certified life coach and a practitioner at the Healing Consciousness Foundation, which is just such a great foundation. I love you guys.
We love you too.
How did you come to meet? It's a great story.
Well, I was asked to go to Holy Redeemer and have my headshots done for some brochure or something, and it was the day after Christmas because that was the day that was available. And I showed up, and there was this very nice photographer, Scott, had great mojo, really liked him. And he took good pictures and he let me look at them right away to see if I liked them before he left.
Just important.
Yeah, because I'm a 3D person. It's hard to get me on a picture. So I left and I gave him a copy of my book. I said, I feel like you're someone you know is supposed to read this. So he took it home, and maybe 24, 48 hours later, I got this fabulous email from Karen going, okay, I really love you. Don't take it the wrong way. But
I know, I'm married. It's all good.
And she said, like, I need to meet you for coffee because, like, you touched my life. You touched my soul.
Wow. And how did she touch your soul?
Her life's mission that comes through so clearly in the Healing Consciousness is my mission. So
Which is?
About integrated holistic healing, believing that the healing potential is within the individual and supporting them. A lot of cancer diagnoses are wake-up calls for people. And that's great because you wake up, and as Beth says, it's an opportunity, but a lot of people don't necessarily know what to do with that opportunity or what to do once they've woken up, because a lot of your old habits of thinking and ways of being are what end up needing to be shifted. But if it's what you're used to and you don't know how to shift it in order to take advantage of the opportunity and create a better life for yourself that's more in alignment with your priorities, reduced stress and other things of that nature, you need support, and that's where I get to help. That's the work that I do. And to be able to be a part of this foundation and help people in this way is phenomenal for me.
When we cure breast cancer, if I have a patient who's cured of breast cancer, and if they sit in their kitchen with fear and anxiety, with the lights off, waiting for cancer to come back, I may have been able to physically cure a cancer, but I have not helped that person heal.
And that was what you said about Diane, who was in this chair a second ago. You said because she went back to that high stress, high caliber life.
They get past the diagnosis and the treatment, and they go, what do I do now? Because that life that they had before doesn't really exist, or if it does, they sit there in fear, afraid that something else is going to happen. And that's where Karen comes in and our other practitioners, because they help get rid of that anxiety and fear and say, you know, be present in the moment. You know, be accountable for who you are, and find what makes your heart sing. Find what that passion is that's deep inside of you, and let it come out, because that's where the answers are.
But you don't have to have a diagnosis with breast cancer to go to your foundation.
Now, we help a lot of patients. We call them previvors. We have a support group for patients that are at high risk genetically, and our patients that are diagnosed with atypia or things that we know put them at higher risk. We try to get them into stress reduction, the yoga, the meditation, the healthy cooking classes, the exercise classes, and we want them to learn the lessons before a diagnosis so they don't necessarily have to get that diagnosis.
That's listening to the whispers of the universe, as Beth writes so beautifully.
Cancer's a scream. People pay attention to screams. I want them to listen to the whispers, and that's where Karen comes in, because when you say, okay, I just got a whisper from the universe, I need to change things, Karen, what she does as she coaches, she's not telling you what to do, she's helping you to figure it out from the inside out.
Hear your own voice, and then help hold you accountable to creating baby doable steps so that you can ultimately change your life.
What's the number one thing that you find you're telling people, Karen?
I don't tell them anything. I listen and reflect back what I hear from them.
Okay. And just help them listen to their own whispers, in other words.
Exactly, because I don't have anybody else's answers for what's right or wrong in their life or why they might be getting this wake-up call.
That's the difference between coaching and therapy.
Okay. The answers are within you.
Right. Yes.
But I love that you also said, Beth, that people have to think about eating healthy. and
It's
get
what you put in your
holistic.
body. And
We're all told, drink the red wine every night, and you're
here's the
saying
deal.
don't do that.
No, red wine it's all in moderation. If you have a glass of red wine, between 3 and 5 times a week, and you have 4 ounces, not 8 ounces, or half a bottle, you can get the benefits, the resveratrol, the heart benefits, and that from it. But if you're drinking 3 glasses of wine a night because you're trying to numb your feelings from the day.
You're not listening to your
You're upping
whispers,
your risk
right.
by about 40% because alcohol competes with estrogen degradation. So it's not a good thing.
So listen to the whispers. That's a good thing.
Listen to the
Always.
whispers.
Pink bingo.
Don't wait for a scream. And Pink Bingo, October 26th.